Hi, I'm Dr. Loretta Stambaugh. This is part 3 of what to expect at your next well checkup. We are talking today about adolescents specifically. We want to give you a quick, brief 5-minute overview of what to expect when you take your teenager to the doctor for these checkups. First and foremost, make sure your children have, or your teenagers have, yearly checkups. There are a lot of things that come up, specifically mental health issues and emotional issues and adjustment issues and academic things that we need to talk to them about. So most of us will hit a lot of these points at every well checkup, and things come up that we don't really necessarily expect. So this is an opportunity for your child to grow and learn and become more independent as they talk to us. It's important for them to talk to us individually. It's important for them to answer our questions and ask questions. So keep that in mind when you come in for a checkup. It's really a good thing to start having your child sort of initiate the visit and sort of take charge of their own health. As they get older, the things that they may discuss at some points may be confidential. We are allowed to be confidential with them, and we are allowed to discuss sensitive topics with them, but we are mandated to share with the parents and hopefully with the child, anything that is dangerous to themselves or to anybody else. But as far as the teenage issues like drugs and sex and drinking, things of that nature, we certainly can talk to them about it and have them feel open with us, and we will guide them just as you would in a mature and safe way. So that's just an aside, because I think a lot of teenagers sort of long for some support with those issues. We can't deny that they happen, so and they're exposed to it. So we want to make sure it's an environment where they can come and feel free to talk about these things. And we will try to instill the morals that you do at home, because I think we all want the same things for our children. The physical part of the exam, occasionally I will ask if the teenager wants a parent to leave the room or to be in the room. Of course, we won't do any sensitive exams without a chaperone. That's really important for males and females. It is a time for them to sort of stand on their own 2 feet as they're gaining this independence and take charge of their health. So that's probably the biggest take-home message for this video. The next thing is we're going to maybe do some vaccines, usually at the 6th grade visit. And again, at 16, they need to get some shots and boosters at 16. I like to sort of ask them what their fears are, what their goals are. I think if you ask some open-ended questions, a lot of times you'll get somewhere, and you might not get somewhere in the beginning of the visit. Lots of times I'll sort of have to pull it out of kids, and then there comes a point where it just sort of snaps, and all of a sudden they're opening up to me. So it's an important process, and it ensures that they trust me or whoever the provider is, and that we can build a rapport with them. So that's really important. Teenagers are complicated, and they're going through a lot with their hormonal changes and, work and school and academics and things that are new in their life that they never had to balance before. It's a transition that they need to adjust to. So we need to be sensitive to that, but we need to instill the responsibilities for them as well. They need to do what they need to do to be successful, and we need to kind of help them along. You can't do it for them. You can't force them to talk to you. I've learned that. But you can sort of set the stage and the environment for them to feel safe, and they open up to you usually. So if you're having issues with your teenager, just, give us a call. We can have them come and talk to our therapist if need be. It doesn't have to be something that is necessarily a mental health diagnosis or something that is a problem. You just think of it as somebody coming in to talk to a therapist, a neutral person, just to sort out their feelings. And it's really very therapeutic for a lot of these kids. So, think about that. And a lot of the kids need to be sort of prompted, but once they get into therapy, a lot of times it really is helpful for them. Even your most well-adjusted kid can benefit from therapy. What else can we talk about with these visits? Sometimes we'll check lipid panel, which is cholesterol. That's just done with a finger stick in our office. That checks triglycerides, the fatty part of your blood, and the high cholesterol, low cholesterol, or total cholesterol, good and bad cholesterol. It is, important to understand teenagers come from a different perspective than we do. Their brains are still developing up until their 20s, so they're not quite there yet, and they have a lot coming at them. So if you kind of approach it that way, and a lot of times they are, I guess, egocentric, should I say, not really seeing their perspective, the perspective of others in their world. So we have to kind of help them get there, and that's what teenagers need, I think, more than anything. But if you have any questions, let me know, and hopefully your kiddo's next checkup will run smoothly because they'll know what to expect, and so will you. Have a good day. Bye.